Hello students. Today we will discuss regarding the intraoperative phase of preoperative nursing. So in the intraoperative phase, let's discuss about the surgical team. The surgical team consists of those members who are responsible for the surgery of the patient. So in the surgical team there will be a surgeon, the anesthesiologist, scrub nurse and a circulating nurse. So, the surgeon is responsible for determining the preoperative diagnosis, the choice and execution of the surgical procedure, the explanation of the risks and benefits, obtaining informed consent, and the postoperative management of the patient's care. So, in elective surgery, elective means in the planned surgery, the surgeon is responsible for giving the overall information to the patient regarding the diagnosis, what are the possible benefits and risks of the surgery, and he is also responsible for obtaining a permission or consent from the patients. And after the surgery, for the post-operative management, the surgeon is responsible. Next comes the scrub nurse. The scrub nurse is a registered nurse or a scrub technician. So the scrub technician means it refers to the registered nurse itself. So they are responsible for preparation of supplies and equipments on the sterile field. Sterile field we have already discussed in the infection prevention and control unit. So everyone what is sterile field. So the nurse is responsible for preparation of all the instruments, all the equipments and the supplies on the sterile field. That equipment should be sterile because it will go inside the patient's body. Maintenance of patient's safety and integrity, observation of the scrub team for breaks in the sterile field, provision of appropriate sterile instrumentation, sutures and supplies, and Sharps count. So she is responsible for maintaining the sterile environment in the operation theater. She used to help the surgeon with the equipments, and after the surgery she will count each and everything which is needed for surgery. I mean, before handing over to the surgeon, after taking out all the instruments, she will again check out the instruments. Cotton swabs and all also it should be checked. If by mistaken, if anything happens to stay inside the patient's body, then it will cause complications to the patient. So this thing should be counted after the surgery. Next comes the circulating nurse. So what is circulating nurse? This nurse is responsible for creating a safe environment, managing the activities outside the sterile field. So this nurse is not involved in the surgery with the surgeon. She will remain outside the surgery, I mean from the operation theater room, but she will manage all the outdoor activities like documenting intraoperative nursing care and ensuring surgical specimens are identified and placed in the right media. So she will be responsible for documenting all the intraoperative nursing care which is given to the patient, and any surgical specimen like suppose for example gallbladder tissue, appendix tissue of the patient will be labeled, and it will be kept in a specimen container, and it should be in the right media. In charge of the instrument and Sharps count and communicating relevant information to individual outside of the operation theater such as family members. So anything which happens inside the OT, she will convey it to the family members. Next is anesthesiologist and anesthetist. So anesthesiologist and anesthetist, he or she is a major part of the surgical team. So anesthetizing the patient, providing appropriate levels of pain relief, monitoring the patient's physiologic status, and providing the best operative conditions for the surgeon. Anesthesiologist and anesthetist are responsible for providing anesthesia and pain relief measure to the patient. And also, as we already know that anesthesia, when the patient is under anesthesia, all the muscles gets relaxed. So the physiological parameters like respiration, heart rate, everything is monitored by the anesthesiologist. And other personnel which are needed in the intraoperative the surgical team are pathologist, radiologist and perfusionist. So what are the nursing roles in a intraoperative phase? First one is staff education, next is client or family teaching, third one is support and reassurance to the patient, advocacy, control of the environment, and provision of resources. So these are some nursing roles which the nurse have to do. Then maintenance of asepsis. You know how the aseptic technique is maintained in the operation theater. We have already discussed regarding this in the previous unit. Monitoring of physiological and psychological status of the patient, ensure sterility, and alert for breaks. So coming to the proper technique for scrubbing into a surgical field. So we have already discussed regarding the sterile field technique. Now during a surgery, what is the proper technique for scrubbing? The first one is team members, fingers and hands should be scrubbed first with progression to the forearm and elbows. So from the hands and fingers, we have to clean our hands, clean and scrub our hands till the forearm and the elbows at last. The hand should be held away from the surgical attire. After donning the gloves or gown, the hand should be kept away from the surgical attire. The hand should be held up once clean so that no suds or other bacteria can drift down onto the clean area. So I think you remember that during the medical hand washing technique, we used to keep our hands down as the elbow is considered as the least contaminated area, but in surgical hand washing, we used to consider our hands as the most cleanest part and elbow the most contaminated part. So we have to keep our hands uh, we have to keep our hands upside so that there is no contamination or any invasion of bacteria. When waterless gels are used for asepsis, you should first wash your hands and forearms thoroughly with soap and water, then dry before putting on the gel. So if any antiseptic gel is used, after hand washing we have to dry our hands thoroughly. After that only we can use that aseptic gel. Then you can enter the surgical area and put on the surgical gown and gloves. So after scrubbing, you can don the surgical gown and surgical gloves. In the patient positioning, we know in the operation theater, according to the surgery, in which part the surgery will be done, according to that we have to position the patient. So the positionings may be supine, prone, lateral, sitting, etc. Definition of anesthesia and other things we will discuss in the next class. Thank you.